HealthPathways is a unique tool where we have multiple clinical conditions on the one platform. It's designed for GPs, by GPs, and we have the confidence of having local specialist input.
I'm a hospital specialist paediatrician, and I think HealthPathways is really helpful for both clinicians in the hospital as well as clinicians in their GP practices.
HealthPathway is a daily usage. I use it probably once a day at least.
HealthPathways can be integrated into your GP practice software, and that allows you to look at the information whilst you've got the patient and family in front of you. It gives you that immediate access to information, so it is really going to reduce that time in ringing around to find out what to do.
I find it really useful for conditions where I don't see often. I can look up the information, and at the bottom of the pathway there will be links to reputable sources of other information and also links to patient information.
If you're kind of knowing where to find the information without having to go to the next room or pick up the phone and call a friend to ask for help, that gives a lot of confidence. Look, I have enough confidence in myself, but the patients will have confidence in me, which is obviously quite helpful.
One of the unique aspects of HealthPathways is that it has referral information that is localised. So this would include both private local specialist and also public services.
Your common referral pathways are not always active. Sometimes people are on holidays. Sometimes people have changed their location. What do I do? HealthPathways will provide you an option.
They're linked and interlinked, and so even though you might look up one referral pathway separately, you'll find that as you get more familiar with the whole suite of health pathways, that it actually joins up and integrates with each other. Clarifies as well what the referral criteria for different services are, so you're not referring patients and families that might get their referral rejected or declined because they don't meet the criteria. It gives you guidance as to where else to seek options for services for your patients and families, and gives them an understanding of the waiting time list as well. It provides up-to-date information on age criteria or specific conditions that different clinics will see, and that may be different to the information that you might get from your colleague that you know quite well, and the specialist clinics might have a different referral criteria to the specialist that you've spoken to.
Once you get familiar with it, it makes the use fast, so it can save you time in consultations, improve your clinical care because you can follow the pathway. In our practice, we've been able to develop autofills for various conditions in our software so that we know that saves us time and makes us more efficient. It's a quick, easy way to check that you're providing both the best care for your patient and that you're staying within the Medicare and PBS rules.
I think the developmental pathways are very good and useful pathways for all clinicians to refer to. It gives you information on how you can actually access allied health in the community whilst you're waiting for a specialist paediatrician review. There's lots of information around resources for mental health in the community as well that's been developed, and I think that's really useful for all clinicians. Often we don't know what other options are available when we need to discharge a patient from hospital, and those resources are actually available through the HealthPathways system as well.
There's no cost to general practice and primary care for HealthPathways, and so you're getting a lot of quality information at no cost. It gives us the opportunity to know what's available and ensure that our patient is referred to the right service. It's the right person at the right place at the right time.
Mate, you got to try it. It's really, really helpful.